Essentially, we started the Health and Wellness Fair last year to kind of inspire our community to live a healthy lifestyle. And this year, in the midst of the pandemic, we realized how important it is to kind of promote and facilitate a discussion about health and wellness within our community. And that's kind of why we're having this virtual health fair. So what you're gonna see right now is I'm gonna start off with a short clip to start the discussion. And then we're gonna have two presenters who are gonna give you some short presentation about COVID-19 and the vaccination. And then we're gonna open it up to questions and answers from you all. So I'm just gonna start off with this video for you all, okay? If you can give me one, okay.
Audience about the new vaccines.
I'm not gonna be a guinea pig.
And so you're definitely not gonna be the first one in line.
King trying to overcome deep mistrust while at the same time pushing health officials to make the community a priority.
This is critical for this community to really make some inroads that can impact our longer term health.
With COVID nearly 3 times more deadly in Black and Latino communities, leading African-American medical professionals also speaking up.
We are urging our community to take safe and effective vaccines once available.
For the minority communities to get access to the vaccines in an equitable way is very important.
Dr. Valerie Montgomery Rice agrees with the CDC panel that healthcare workers should be a priority, but not just doctors and nurses.
There's a significant number of Black and brown people who work in those facilities and who work on the front line.
So we're talking about a very broad definition of healthcare workers.
Yes.
Each state decides distribution details. New York promising equity.
This has to be an inclusive process. The Black, brown, and poor community has paid the highest price for COVID.
And to help show the vaccines can be trusted, Dr. Victoria Smith at a hospital near New Orleans volunteered for a clinical trial.
I wanted to be a model of for my patients.
She's not alone. Some 30% or more of the participants in 2 clinical trials are from minority groups after stepped up outreach. Do you think there's going to be acceptance?
Many of my patients who have been affected by COVID, losing family members, I think are a little bit more likely to accept it.
The CDC will release guidance once a vaccine is authorized. Ron Allen, NBC News, New York.
I called you.
This year, Santa's.
Alrighty, so we kind of just wanted to, as you all can see, we know that COVID has affected the minority populations more significantly than other populations. And just to start off our discussion with a presentation, will be our first presenter, Dr. Abdul Fatai Ajibola Ilupeju. Dr. Ilupeju was born in Ibadan, Oyo State, Nigeria. He received his bachelor's of dental surgery from the University of Lagos College of Medicine. He then relocated to the United States and obtained his Doctor of Medicine from Boston University School of Medicine in Massachusetts. Dr. Ilupeju also received his master's in public health from University of Alabama, Birmingham, Alabama. He's board certified. He's a board certified anesthesiologist and currently the chief of anesthesia at Lemuel Shattuck Hospital in Jamaica Plain, Massachusetts. Dr. Ilupeju will be providing a brief overview of COVID-19, the vaccination, and kind of in a historical context about research in minority populations. Dr. Ilupeju, you can share your screen now with everyone.
Can you see my screen?
Yes, we can.
Okay, thank you. See, I wasn't aware I didn't see the screen, the earlier one. I thought everybody was seeing it. Well, I was be live in the shaitan rajim. Bismillahirrahmanirrahim. Alhamdulillah wa salatu wa salamu ala rasulih. Welcome back again. For those of you who were here the last time, I'm sorry, I apologize for not seeing my screen. Today we are talking about COVID-19 and vaccinations in continuation of our platform program. We currently are on precedented time in this country and everywhere in the world with this menace of coronavirus pandemic. I know we had some talk about this in the past on coronavirus, but this time today we're talking about the vaccination and the reason why we should or should not get it. As a preamble, we all know about the disease. This time last year, there was nothing like coronavirus anywhere, except that we know there was a SARS virus back in 2003, 2005, which happened in Southeast Asia, which was supposed to be deadly. But that was very, very minimal in terms of the epidemiology and the effects on the population. But this one is unwarranted, unprecedented, and it's of a massive scale. We've lost a lot of people this year, a lot of misery, a lot of financial loss because of this disease. And that's why we should talk about it and explain to ourselves what we need to do. If you look at the progression of the disease, since it came to the country in February, the increase has been exponential. In April, we reached 581,000. By June, it was already 2 million cases. And August, 6 million, and October, 12.5 million. Right now, last week it was 17.5 million, and total deaths of 315,000 people are dead from this disease. So it's a very bad situation for us, and we have to find a solution to this problem. And that's why we need to do this, to educate ourselves to understand what's going on. So what can we do to spread the jam, the disease? Basically, what will be informed by the Department of State, CDC, and our local health officials, social distancing, keep away from each other at least 6 feet, cover your nose, cover your face, cover your mouth when you sneeze and cough, wear a face mask in public, do not touch surfaces and touch your face or mouth with it, clean and disinfect areas which people touch frequently, like door handles, railings, and stuff like that. If you feel sick, stay home, wash your hands, and sanitize frequently. Those are the basic things we have to do. And once we do that, we are sure to at least protect ourselves and our loved one to an extent. Now, there are a lot of controversies about the vaccines because what we have to do about this disease, we have to find a way to protect ourselves. But in the history of the US, there's a lot of mistrust, misunderstanding, and mismanagement of care of people of African American origin, other people of color in the medical health system. Racism is part of it, and often neglect and irreverent taking care of people is another part of the issue. So there are many events in the past which colored people's thinking and understanding and belief in the system. One of them is the Tuskegee syphilis experiment, which happened in the Tuskegee Institute, Alabama. The other one is the genocide, which is a unique program in North Carolina, where people were being systematically sterilized. There's a Pfizer problem in Nigeria in 1986, which was during the outbreak of meningitis, and Pfizer went there to try their new drug to find a way to show that the drug was effective. And then healthcare disparities in the US general in total, and I'll talk about each one of them one by one. In the Tuskegee experiment, African-American males were reassured by the public health system that they would give them care when they had syphilis. Unknown to them, they were being used as guinea pigs to study the effect of syphilis and how it progressed in the body. So they were not actually treated. They would just watch them and observe them, what happened to them, until many of them died of syphilis. It's a big issue. There are still ongoing currents of people trying to look for redress on this issue. This is a picture of what happened in Alabama. The doctors will go there into the townships and see Black people and take their blood, talk to them, and pretend as if they are treating them, but they were not giving them treatment during the period of the study. In North Carolina, The idea was to target people with disabilities, people in institutions who thinks they may have some defective gene, to find a way to not make them reproduce. So what they did was that they sterilized them. If it's a woman, they give them hysterectomies, male vasectomies, and stuff like that. And this was done on majority of Black people in North Carolina. In 1997, President Clinton had to apologize for this behavior, and some of the people were actually compensated. Now, in Nigeria, what happened with Pfizer is that they were trying to try a new antibiotic called Trovan for meningitis. But before 1997, as far back as the 70s, we know their treatment for meningitis, and it's well established. But what they were trying to do was to show that the one they have in new antibiotics is equally effective as against ceftriaxone and other things we use then. So what they did was that they doctored the experiment. Instead of giving the kids the actual amount of dose they're supposed to give them for the ceftriaxone, they gave them like a quarter of the dose, and then compare that result with their result. Out of the 100 people, kids they used there at that time, I think 11 of them died. So it became a big legal case, which was running into billions. But like I said, with the Nigerian government, because of their corruption and the way they do things, they settled for $70 million. That was the Kano State government then. But other than that, in the healthcare system here in the US, there are a lot of disparities you see. If you look at the healthcare statistics in the country, any kind of disease you look at, whether it's diabetes, hypertension, mental health, whatever, the minorities are being the short end of the stick in most cases. So that gives room for people to doubt the sincerity of the government in healthcare. Anything they want to do, people have reason to be doubtful and skeptical. But in the history of the world, we've had pandemics before. We have a lot of diseases which are very, very dangerous, deadly, fatal, which we've dealt with. And we have to use vaccines for them. One is smallpox, which I'm showing you smallpox now. Some people don't know how smallpox looks. This is how it looks when you see active smallpox. It's a very devastating disease, and it kills 30% of people infected. And the rest, 50%, are deformed, because after this heal, it leaves pustules on their skin, and they have like what they call pock marks on the skin. So this guy here is smallpox, and this is chickenpox, varicella. So all those things we've seen in the past, tuberculosis, diphtheria, they have vaccines which we use to prevent them from coming back. So how do we get rid of the pandemic? So to get rid of it, we have two things. One, we have to be immune against it. Individual immunity is very important. If you have a very strong immunity, that will help you against many diseases. The community where we live has to be communally immune also. If everybody is healthy and have a way of warding off the disease, then there's less chance of this coming into community. That's where the issue of herd immunity come into place. So all it says is that if a particular percentage of population can be immunized or vaccinated or exposed to disease and develop antibody, then there will be less chance for the disease to spread. Basically, that's what that means. And how do we develop an immunity if we don't have a special individual immunity? Vaccination is the surest way we've been doing it over the years. And we've had so many vaccines in the past, which many of us have records of our immunizations. So the controversies all over the world, there have been epidemics from time to time. We have the flu of 1918, diphtheria, whooping cough, tetanus, polio, Salk vaccine, Sabin vaccine, measles, mumps, rubella, hepatitis B. So each of these epidemics eventually will get a vaccine to take care of them. The vaccines are not safe because there are different types of vaccine. Some are made with killed viruses. Some use live viruses which are attenuated. And some of them use some substances from the virus to stimulate the body to produce antibodies. If you remember the polio virus, the initial one by Salk, when it was given, 15% of the people who got the virus developed polio because it was a life attenuated virus. It was still alive, but was weakened. So people with weakened immune system could not develop enough immunity to generate antibody. So they succumbed to the virus. And later they came out with the oral one, which is 7, which was much safer to use. So in Nigeria, when I was a kid, I got this vaccine. Look at it, it looks like a machine gun. This is how we get vaccinated in Nigeria then. This was TB and smallpox. It comes like a big gun and they jab you, and the needle is like a spike needle, like two tips that goes in, comes out, go back in again, twice. So you develop a little blister in there and there's a mark. Most of us who have it, if you look at your genital area, you see the mark up to today, the mark is still there, it doesn't go away. So herd immunity, this is just an illustration of herd immunity. It shows you a group of people in blue here who are healthy, and the 2 red who are the disease. So the disease spread around everybody, and before you know it, everybody is all sick. And then some of the people get immunized. When they get immunized, it turns to yellow. So the yellow one around the red people. So when you're immunized, the sick person cannot infect you anymore. So as more people get immunized or get sick and get healthy, they become yellow, which means they have some protection. And eventually the whole population is almost all yellow. And if you look at this, well, on the right lower side here, the red, which is the sick person, is surrounded by all yellow immunized people. So you cannot transmit the disease. Well, anyway, so that's exactly what the immunity is all about. Now, we have a vaccine now, which has been approved for use. There are 2 of them. One is from the Pfizer BioNTech company, and the other one is from Moderna. They are basically the same type of vaccine. The mRNA vaccine is made from an mRNA strand in the spike protein of the virus. The virus has 29 proteins around it, but the spike protein is the one that used to attach to human cells. And that's what they took and synthesized in the lab and inject into the skin to give the antigenic reaction. It's not a live virus, so it will not cause you disease. What it does is that it produces antibodies that will block the entry of the virus into our cells and therefore prevent infection. And this has been approved for use since December 13, and people are already getting the vaccine in the US. So, to brief explanation of the vaccine, it's been tested and found to be safe to use in the US and other places. Like I said, it's not a new technology. It's been studied for many years and it's been safe to use. It does not contain a live virus. There's no risk of disease in the people who are vaccinated. It does not go into your nucleus cell and does not interact with your DNA. What that means is that all the noise we hear on the internet about the vaccine going to your DNA, disrupting your DNA, causing this, it's not true. It does not enter into your DNA. It's not a live virus, and it does not cause any DNA splicing or DNA interlocation in the system. So basically, that's what I have about the virus. For administration of the vaccine, 2 doses intramuscularly 3 weeks apart. The second dose has to be given between 17 and 21 days of the first one. Both of them are necessary for a full immunity. If you don't take the second one, you will not have a full immunity. So you have to take the second one.
Dr. Ilupeju, sorry, if you can, 5 more minutes or so.
Okay. I'll be done. So now, what are the recommendations for the virus? the protection is not immediate. The 2 doses has to be taken before you can be fully vaccinated, like I said. No vaccine is 100% effective. Given the information we have now, it will reduce the disease in the society, the severity and the transmission will be reduced once everybody gets vaccinated. But before that, we have to continue wearing our mask, staying at least 6 feet away from others, avoiding crowds, washing hands often, and following all the CDC guidelines. So there are different categories of people who will be taking the vaccine. Like I've said earlier, the vaccine we have now, the one for the biotech, the Pfizer one, is for people above 16 years of age, and for the Moderna is for those above 18. Currently, there are studies going on the effect of the vaccine on children and also on pregnant women. As soon as we get a result from that, you'll probably allow them to take it. And that's all I have for everybody. Anybody have any questions? Shukran jazilan.
Dr. Ilupeju. So I'm just going to introduce our next presenter. Our next presenter, someone I've known for a very long time. I like to say she's a lifelong learner and is always really passionate about serving our community and making sure that our community is healthy and well. So Dr. Oke is from Ijebu-Ode, Ogun State, Nigeria. She received her Bachelor's of Nursing. So she loves University of Maryland so much that she received 3 degrees from the University of Maryland. So she received her Bachelor's of Nursing from the University of Maryland, her Master's in Public Health from the University of Maryland School of Medicine, as well as her Doctor of Pharmacy from the University of Maryland School of Pharmacy. Her area of expertise is ambulatory care and chronic disease management, and she currently serves as a primary care clinical pharmacy specialist with prescriptive authority with the Veterans Affairs. Dr. Oke, thank you so much for joining us. We look forward to your presentation. Would you like me to share my screen for you as well?
Yes, please. Yes, please. So, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for being on here today, and thank you for this opportunity to share this very important information with you. So we're all here talking about COVID-19 because yes, we're living in the pandemic right now, and what can we do about it? Thank you so much, Dr. Ilupeju, for the beautiful, very in-depth presentation, so that we know why people are a bit scared about all this, because their reservations they're actually founded. So I understand what you're going through. I understand your concerns, but yes, I hope I could possibly influence your decision in a positive way today. All righty, so second slide, please. So I'm going to be sharing some quick facts with you. Fact: COVID-19 vaccine will not give you COVID-19 infection. I know Dr. Ilupeju said that earlier, but I just wanted to drum it in. Another fact: COVID-19 vaccine will not cause you to test positive on the COVID-19 viral tests. And this is very important because sometimes people say, okay, I got a vaccine, I got a flu shot, and guess what? I got sick afterwards. No, darling, you did not get sick from the vaccine. You got sick because possibly you got infected prior to getting the vaccine, or you got infected right after getting the vaccine because you were not protected. So something we need to keep in mind: once we get a vaccine, it does not mean it's going to work immediately. It takes about 2 weeks to build immunity. So please keep that in mind. Another fact: receiving an mRNA vaccine will not alter your DNA. So I'm going to show you a picture of what an mRNA looks like and what a DNA looks like. Next slide, please. So your DNA is double-stranded. Your mRNA is single-stranded. The mRNA, the COVID itself, the coronavirus, is a family of single-stranded RNA viruses. Hence the reason we are using an RNA vaccine, mRNA vaccine. Someone was asking earlier about what about the fact that they talked about aborted fetuses when they were making vaccines. So that sounds very sensational. Gosh, the person that did that did a beautiful job putting that word out there. But back in the days when they used to make vaccines, right? back in when we started developing vaccines from the beginning of time, there was one aborted case, and they tried to do it later in China, but it just did not go through. But this one, Dr. Ilupeju kind of said that we use inactivated viruses, but in this case, we're actually using an RNA that was replicated, gotten from the virus and replicated in the lab, and we put things together. So we're not using any aborted fetuses. So I wanted to make sure I made that clear, because sometimes when we type, we kind of miscommunicate. So I wanted to address that right there. So the goal here is to train the immune system to recognize and attack the viral particles before they can overwhelm our cell. Full stop. That's what we do with vaccines. Next slide, please. Okay, so why should you get the vaccine? And why should you trust the vaccine before you even think about getting it? Well, researchers have been studying and working with mRNA vaccines for decades. They've used them they use them for some other viruses. I think rabies, flu. They studied those in that. They've also used it in cancer research to trigger immune system to target specific cancer cells. So they've been using this for a long time, and it's easily made in the lab. That's the reason why this process of making this vaccine was a bit faster too. Next slide, please. So why should you trust it still, right? So before a vaccine is tested in humans, it is given to animals to see if it produces a strong immune response without producing health problems. So the benefits have to outweigh the risk before they let it out for the population to use, all right? So most clinical trials go over a couple of years, but in this case, they did something really, really smart, because we had a lot of researchers from a lot of brains from all over the world trying to figure out one thing: how to get this pandemic under control so we can stop losing lives, we can stop losing money, right? So instead of doing phase 1, phase 2, phase 3, and waiting a couple of months and seeing the results in between steps, they did them all simultaneously. So they did not there was no shortcut. It's just they were just doing things a little more faster and more effectively. So they've been held to the same rigorous safety and effectiveness standards as all other types of vaccines in the United States. Next slide, please. Okay, another fact. Getting a COVID-19 vaccine can prevent you from getting seriously ill, even if you're exposed to the virus. And also, it can also help protect people that cannot even get vaccinated because the immune system cannot tolerate it. Another fact is this: people who have gotten sick with COVID-19 in the past may still benefit from getting vaccinated, because early evidence suggests that natural immunity from COVID-19 may not last very long. So we've had people that got sick with COVID-19 in the past, and then they got sick again because the immunity went off, it waned. So people may still benefit from getting the vaccine. As Muslims, we're always interested about if something has gelatin in it. Thankfully, these researchers were smart. They did not include gelatin in this vaccine. So we're good. The vaccine doses will be given to the American people at no cost. So you may get a charge. That's not for the vaccine. That may just be for the administration costs. So the pharmacist, the nurse giving you the vaccine may charge, but don't worry about it, because insurance, either private or public, will cover it. And if you don't have insurance, the CARES Act will take care of that too. So don't worry. Next slide, please. Okay, you decided you wanted to get the vaccine. You got it. Good job. So what next? What happens? So like I said, please keep this in mind. It usually takes a few weeks for antibodies to be produced after you get vaccinated. Therefore, it is possible that you can get infected if you're not protecting yourself, washing your hands, using your mask after you've gotten the vaccine. So remember, there are 2 doses here. We have the first dose, which you get, and then there's a second dose. So what are the common side effects? So let me tell you this. I got my vaccine yesterday, and the only side effect I could say was like I had a sore arm. And that happens when I get the flu shot, no big deal, right? So what are the common side effects? Muscle pain or injection site pain like I had, redness or swelling. Can you guys hear me? Changed. Redness or swelling, fever or chills, tiredness, headaches, joint pain, nausea, or feeling unwell. And this happens because this is just a normal response. So let me tell you why. Sometimes after vaccination, the process of building immunity can cause symptoms such as those. These symptoms are normal and they're a sign that the body is actually doing what it's supposed to be doing, building immunity. Okay, so so for side effects wise, right, the first dose we get, this first dose that we get, the side effects is not as bad because the body is just starting to do what it's supposed to. The second dose, the side effects may be a little more. So you may see more of the feeling a little more tired versus so I just want you to keep that in mind. But even after you get the first dose and you experience some side effects, please don't go back and say, I'm not going to get the second dose. Because if you get, so just imagine this, right? You're trying to cross a river and you have a bridge and the bridge is going, and we've not gotten to the end of the river and the bridge stops, right? You're not going to cross the river. You're not going to achieve your goal. So it's the same thing. Theory goes with this vaccine. If you don't get the 2 doses you're supposed to get, you will not start to build the immunity your body needs. All right. So keep in mind this, most of the side effects go away within 48 hours. So we're good. Next slide, please. Okay. All righty. So we already talked about all that. And so there's also something called V-Safe. And V-Safe is just a little smartphone-based tool that uses text messaging and web service to provide personalized health check-ins after you receive a COVID-19 vaccine. So through V-Safe, you can quickly tell the CDC if you have any side effects after getting COVID-19 vaccine. So because this technology, this vaccine is new, right? Where science is not a one size fits all. Medicine is a beautiful science. You are constantly learning. You cannot say, I've learned it and I'm good. No. So we all have to do our part to make sure this is a process. And let's all remember, viruses are our last tools. They do what they're supposed to do. But Allah said that he has not created a disease without a cure. So this vaccine is just getting us an inch closer to that goal. Last slide, please. So we are all worried, right? We've been hearing the United Kingdom, they're closing the borders to it. There's a new COVID strain. There's one in Nigeria, in South Africa. Well, so yes, you need to be concerned, right? This new COVID strain in the United Kingdom has a series of mutations and it is more transmittable than other strains, but they've not found it to be more deadly. So let's keep this in mind. You can easily get it. It's more contagious, but it is not more severe or more deadly. And big deal is this, some drugs don't work. Some drugs that we've used for other COVID strains, they don't work for it. So it is a big deal. But what about the vaccine, right? Studies are still going on to test to see if this vaccine will be effective. But I just want you to keep this in mind. The COVID vaccines that were approved by the FDA, they produce antibodies that target several parts of that spike protein. So even though this one has mutated, they're still going to target certain parts of that spike. So it should still work. Remember, the spike protein on the virus is what lets the virus get into our cells and start to cause havoc. So the vaccine we have still targets certain parts of that spike protein, so it should work. So lastly, vaccines protect individuals and communities. When enough people are vaccinated against a certain disease and develop immunity, the germs can't travel as easily from person to person, and the entire community is less likely to get sick. Thank you so much for listening. I appreciate you and I appreciate your time. Assalamu alaikum.
Alaikum salam wa barakatuh. Thank you so much, Dr. Okay. Now we're going to open the floor up for questions. I can figure out how to stop. My apologies, my computer is giving me some technical difficulties. Stop. No. Sorry. Dr. Okay or Dr. Ilupeju, if you don't mind.
To start answering the question?
Yeah, please. It's kind of frozen and I'm trying to figure it out.
Okay. Alrighty, so there's the first question is about, I don't see any people with raised hands, so maybe I should look better. I've heard that the majority of multi-use masks such as cloth and homemade masks are not effective in preventing the spread of COVID. Which type of masks are the most effective, and does it prevent you, which types of masks are the most effective, and does it prevent you as a healthy person from getting it, or does it only prevent those who have it from spreading it? Dr. Ilupeju, would you like to answer that, or should I go ahead?
There have been several studies on these masks. I should have put a slide up to show you how effective those masks are compared to each other. Now, the regular surgical mask that people wear around easily everywhere is supposed to be effective to prevent 60 to 70% of viral particles from entering through. If you double that, they said it will give you up to like maybe 85, 90%. The N95 mask that people use for patients who has COVID supposed to prevent 95% of any of those things passing through, not 100%. Now, cloth, which is woven cloth, double-sided cloth woven, has been shown to be almost as effective. But the nature of the cloth, if it's cotton, is better than if it's some fabric from, what do you call it, polyester fabric. Cotton is better. But they put them in range of probably 67, 70% in what they can do. So if you use that, it's probably okay when you go in public, but for somebody clinical, it's not okay. You have to do something a little more than that. I wish I put a slide in here to show everybody can find it, because they actually did the study and they put patients or people who are coughing actively into this mask to see what can go through, what cannot go through. But the most effective to prevent anything going through is the N95 and above. There is an N99, but that one's a bit more difficult to breathe through yourself. So those are the things. So should we wear cloth mask? Yes, wear it if that's what you have. It's still protective. If you wear one and you cough, it will protect people around you, because whatever you cough into it, 70% of it will be contained. If somebody you are talking to also wears one, it's protected 70%. So between the two of you, you are well protected. So if one person is wearing it and that's not wearing it, it's not a good idea. Everybody has to wear it for it to be effective. And that's the key part of mask wearing. Whatever more you can get, sure, it's fine. There are some which are very flimsy, which are made of like foam or whatever from China. That is not going to help you. Don't wear those ones. They're a little foamy, black with a little side breathable thing on the side. They're not effective. They may show that with that one, only 10% protective to 15%. And there are so many people wearing them around because it's fashionable, but it doesn't do anything. I don't have a slide somewhere to show all those tests on those masks, but and that's the thing. So cloth mask is fine if that's what you have, but if you have something better, that's good.
Jazakallah khair. Thank you, Dr. Ilupeju, for that. Aisha, I know your hand was raised and you put it in the chat. Did they address your question, or did you have another question as well? Would you like to unmute yourself? Okay. We'll just go on to the next question. The next question asks, in case of vaccine, how can one convince a person that had a child who suffers from a side effect and developed autism to continuously believe that vaccine alone isn't the reason to autism? So is the question clear? I think I understand.
It is clear, it's just tough.
Well, that's a controversial subject.
Yes, it is.
But we have to follow science and follow studies that are being done by people who are doing the studies. The first report of relationship of autism with vaccine came with the MMR study in England in 1998, I think, in England. And they studied 12 children who had autism. And they used the timeline, the time they developed autism and the time they got the vaccine for MMR, and they blamed MMR for it. But before giving MMR to babies, people have been having autisms for years. So looking at the 12 subjects, I use that in the kind of case control studies to come to that conclusion is not very scientific. Since then, many studies have been done to looking for the relationship between autism and vaccination, and none of them has proved to show any correlation.
Okay.
So that's the part I can tell you. There are other factors that might cause autism. Maternal illness during pregnancy, maternal age during pregnancy, some accidents at birth, anoxia, hypoxia during delivery. There's so many factors, medications which might affect a baby growing up, lack of necessary vitamins, folic acid deficiency and stuff like that, causing neural tube defect, which might give some kind of spectrum of autism. There are so many things that could cause it. Linking vaccine to it became a big thing, and some people who are already against vaccine clamp on it, using it as a propaganda to create more confusion and more misunderstanding among people generally. And that's what I can see from it.
Okay, so thank you, Jazakallah khair. The next question asked, I heard 100 people in the UK died from the vaccine. Have you both heard that? I don't think that's true.
That is not true.
I didn't hear that, no.
Okay, yeah.
That is not true.
Okay, so we're just gonna go on to the next question. How do you know which vaccine to take? So we know that the Moderna and the Pfizer both have been approved.
I already answered that one in the chat.
Okay. So the next, how safe is vaccine? Had there a nurse in New York with it?
She had one, and do all vaccines cover all strains or mutations? I didn't answer that one. And so that's we kind of talked about that earlier, that the vaccines, we're getting mutations, right? And so that's why we're very concerned about the one in the United Kingdom, and we want to see if the vaccine we currently have will work. So that's so for right now, the answer is no. This is an evolving science, and people will continue to study, and that's why we may need to get we may need to get revaccinated in future.
Okay. Thank you. For working parents with young babies and toddlers, would you advise us to send them to daycare at this time or keep them at home?
That's a question which everybody has been asking. It's both a community question and an individual answer to that. What the pediatricians are saying is that majority of the kids above 2 years of age, if possible, to go to a well-controlled daycare. That means what we mean well-controlled, where there's a control in the daycare, where the staff at the daycare are all screened properly, tested regularly, and the kids are screened when they come in, temperatures and stuff like that. If they can assure that be done, it's better for the kids above 12 years of age to be in some kind of daycare or school than being at home at that particular age, from 2 to 5, I said. Some people do not agree with that. They're thinking that, well, how do you know that the staff which are screened today are not infected tomorrow, and the little kid will take the virus and bring it to grandma at home? And that is where the key problem is, because of transmission when the kids get back home. Not so much about the kids themselves, because they found that some kids who are put in a kind of cocoon together for a long period of time, and there were about 10% of them who got infected, but none of them were really sick. So for some reason, the kids were able to withstand the effect of the virus more than adults. That's what they're saying, but there's no concrete evidence of that. But the key is, if the kid is infected, what is the chance of that kid taking the virus back home when you have a sick parent or an older parent at home? And that's where the community has to come to an agreement on what to be done.
So the next question, We have, I feel like the next two questions, if the person who answers it can just answer both at the same time. Why is there a need for multiple doses? And I know you both kind of touched on it.
I just answered that one. So I just answered that one. So,
okay.
Yeah.
Yeah. So what's the long-term effect on infertility and disease? I know we don't know. I know you guys kind of discussed it in your presentation that we don't know the long-term effects. We have to wait for longitudinal like studies and more data to come out. But I don't know if you guys want to add on anything regarding that.
So, well, from what I've heard from people, we should not downplay anything because we don't know. And if we do that, we're doing an injustice to society. But this science has been done, and Allah, there's qadar Allah, right? What will be, and we should accept it as if that's what's supposed to be. There's nothing you can do. So I'd rather be prevent than say, oh, I did not know, and prevent and get vaccinated. That's what I'm trying to say. Then say, oh, maybe this could happen. Maybe a lot of things could happen. Maybe I could drop dead right now. So allow alam. So that's just what I'll say from that.
Okay.
And it is an evolving science. We're continuing to study this.
Yes. So then the last two questions that we're gonna answer today, and then we're gonna call it an end, inshallah. It says, how do we stop the spread of misinformation about the virus through mediums of WhatsApp, Facebook, and etc.? They can often be extreme and even dangerous. I agree. So what's our solution? I mean, for me, I feel like before you send something to someone else, you kind of have to ask yourself, is what I'm sending, like, is it really beneficial to the point that I need to send it and forward this? Is it accurate if I fact check the information that I'm sending? But what are your thoughts, Dr. Okia and Dr. Ilupeju?
I think I'd like to get Dr. Ilupeju's wisdom on this one.
Well, it's a very difficult thing to do. People were different. Some of us are susceptible to any kind of information, whether it's erroneous or not, just to spread it. Some people are so trigger happy once they get something, they just spread it around without even looking at it, what it contains. Because I do challenge some people when I see stuff like that. What do you think about this? Oh, somebody saying to me, I just forward it. But why don't you forward something you did not really understand what's in there? It's very easy to check some facts. If somebody says something to you, you can go to Fact Checker or Snopes or all those sites to check whether it's a fact or not. And that will tell you right away that this is something that has been debunked before, which is not true. There's so many things that people send around on religion, on health, on other things. So we have to educate ourselves. That's probably the most important thing, to educate, to know exactly what it is that someone is talking about. If you don't know anything about it, ask somebody who may know, rather than carry the information all over the place. Like there was a question earlier here about aborted fetus cells being used for vaccine. There might have been some cells they use to grow viruses, which might have been aborted cells, which are young primordial cells. That's possible. The popular one that you use for cells, the immortal line of cells they use in research, is the HeLa cells, which is cervical cancer cells of this woman, Henrietta Lacks. She has cervical cancer, and they took some of the cells and they grew them perpetually in the lab to study how to attack cancer cells, basically. So anybody who's doing research in that area has access to those cells. So some people are saying, oh, they put cancer cells in the vaccine and then they put it into your body and then you get cancer. That is nonsense. We need to find out exactly what is it that they are doing and what is being done before you spread any kind of information, because it can ruin people's lives. And some people don't understand it. Like I said, some people are so trigger happy, they get something, boom, they send it to all over the world.
Yeah.
And that's the problem.
Okay. Jazakallah khair. And there was another question that was a direct message to me. Why can't kids get the vaccine? And I can easily answer this, but I know I'll let you all, but it hasn't been studied in children, right? So we know that the clinical trials were studied in, one of them was studied in 18 years and above, and the other was 16 and above. And that's why it's been approved for these populations. But when we're talking about children, they haven't studied it in these populations. So the goal is that essentially if the majority gets vaccinated, that's why herd immunity is so important, because we know that there are some populations who aren't going to be able to get vaccinated. And so if us that can get vaccinated do get vaccinated, we're able to protect those who can't get vaccinated, inshallah. We have 2 more minutes, inshallah, and I just want to thank our speakers. Thank you both so much, Dr. Akid, Dr. Ilupeju, Jazakallah khair. May Allah increase you both in wisdom and knowledge, put barakah in everything that you do, grant you success in this life and in the hereafter, and grant you Jannatul Firdaus. Jazakallah khair. Thank you all again, and thank you everyone for attending this session. I do see some follow-up questions coming in. I don't know if one of the speakers just want to answer the question in the chat box for the person. But if not, the session is over, inshallah.
I think I had a website. I think I have a website to make sure you get where you get information from the CDC. And I'm going to post that right now. And I just realized when I answered the question to that Sister Aisha, I only sent it to one person. I didn't share it with the group. But this is a website, CDC, where you can get factual information. Like everything else, be very careful where you get your information from. Be very careful where you buy your stuff from. Information is key. Information is power.
Jazakallah khair, everyone. Thank you all so much for attending this session. I hope it was informative. I believe the next session is in the evening, so you all have a break. So I hope you all have a wonderful afternoon. Barakah Jum'ah. Read Surah Al-Kahf if you haven't. Friday. Make lots of dua between Asr and Maghrib, because we know there's an hour that duas are accepted. And then I hope you continue to benefit from this program. Jazakallah khair to the rest of the organizers. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.
Thank you very much, our organizers. We have a special announcement. The announcement is that we are going on break right now. And when we come back, it's 5:30 p.m. for junior platform, 5:30 p.m. Eastern is junior platform program. Then 6:30 p.m. Eastern is Ask the Sheikh. As you go on break, we ask you to consider donating to NCNMO. The fundraising and gala night is tomorrow. May Allah protect us till then. Assalamu alaikum.